Greetings, everybody. My name is Rhiannon Lewis, and I'm delighted and honoured to be part of Aroma Summit. And a very warm thank you, deep gratitude to Dr. Tim Miller for organising this amazing event. My session today is about using hydrolats in clinical care. And I'm looking forward to sharing with you some detail about the use of hydrolats in clinical environments, their potentials, their challenges, and also give you some examples of use in care. So I'm going to share my screen and just let's jump straight in. And basically, I'm really looking forward to sharing this session with you. Of course, in the course of an hour's lecture, I can only give you an overview as to some of the potentials and challenges and examples of using hydrolats in clinical care. But I think this session is going to give you some really good insights. So let's move forward. Just a little bit of introduction to myself before we jump into the big detail. My name, as I say, is Rhiannon Lewis. I'm a practicing aromatherapist since 1989. And for at least 20 of those 30 plus years, I've been using hydrolats in my clinical approach as an aromatherapist, either combined with essential oils or on their own as active agents. I live in France, I live in Provence, and I'm director of a company called Essential Oil Resource Consultants that provides education, information, research, and consultancy in the field of essential oils. And I'm also editor of a journal called the International Journal of Clinical Aromatherapy, which is the IJCA, which has recently become integrated within a platform that I now host and manage called the International Clinical Aromatherapy Network. Amongst other things that I do, I also organize and host international conference events for aromatherapy and plant medicine. These seminars and conferences include the Botanica Conference Series and also the Essence of Clinical Aromatherapy International Seminar, the fourth edition of which is taking place in 2023. One thing I think I need to say is that I'm not affiliated financially or otherwise with any essential oil or hydrolat company or product supplier. The reason I'm saying this is that during this presentation, you will see that I will give examples of different products that contain or are based on hydrolats that are out there on the market. But please don't think that I am endorsing these products. I'm just using them as examples to illustrate certain points that I want to make, to give you good insight as to the role and potential of hydrolats in clinical care. Okay, so let's jump straight in and talk about the lecture aims. In terms of the lecture aims, I'm really looking to demonstrate the potentials and challenges of using hydrolats in clinical care. Now, we will come on to talking in a moment about what I mean by clinical care, but it is important to say that whilst we do have enormous benefits and enormous potentials of using hydrolats in these environments, there are also challenges and limitations. So I wanted to illustrate both the potentials and the challenges that we have in front of us. I also want to give you some clear information about hydrolats, how they're defined, what exactly they are, as well as information about sourcing, handling, and storage, because this is very pragmatic information that I think is important to get across. And then, of course, I want to give you some concrete examples of the use of hydrolats in clinical care. So these are the subject areas we're going to cover. There are 5 steps, if you like, of the session. First of all, I think it's really important to know your tools. And that's where we're going to begin to talk about, as an introduction, as to what we mean by hydrolats, because as you will see, there are many words, many definitions, many similar substances that are not quite the same or that may be the same. And there's a lot of confusion here. And so I wanted to just be clear that for the purposes of this presentation, what exactly I'm talking about when I mention hydrolats. The second point is to talk about the challenges and potentials. And, I'm going to get get over the challenges first. They're not negative. It's just, what we have to bear in mind about introducing them to a clinical environment, and then get into the good stuff, which is really to do with the potentials of using hydrolats in these environments. And we will have some time to talk about as well handling, storage, shelf life, some of these big issues that come up repeatedly because we're talking about fragile substances. And there are some key things that I can tell you about that will help prolong their life and their vitality and their benefits to your patients. Another thing I wanted to do is, of course, take you to the examples of clinical care. And here I'm going to be talking about examples that are already on the market, medical devices, some of them, as well as other products that are out there that incorporate hydrolats, that are like off the shelf, ready to go. But there's also, I wanted to give you some of my own clinical experience, and I'll give you some concrete examples of that as well, with some guidance. And then we're going to wrap it up with a conclusion and some key reminders to take away. Now, the first thing I think I need to say really is that hydrolats are extremely versatile, and they can be used in a multitude of different ways, in a multitude of different domains. So, for example, in beauty care or cosmetology, we can use them in culinary, for culinary uses, for flavoring, etc. We can use them in veterinary care. We can use them at home for general health and well-being. And we can use them energetically. We can use them holistically. And also we can use them clinically. Now, this is where our focus is for this session. It's about the use of hydrolats in clinical care. And you will see that as I go through, I will be emphasizing certain things, and a lot of it's around quality control and the quality and the sourcing of the hydrolats you use, because in clinical care, we're usually working with a vulnerable population. It may be certain age groups that are particularly fragile, for example, babies or the elderly, or it can be people who are sick, or we're dealing with issues that are to do with unhealthy skin or skin breakdown, or areas of disease in mucosal linings, etc., where the person is really at risk. And so the importance of quality control is even more so emphasized in this fragile population. If you have healthy, intact skin, your needs for hydrolats may be really quite different to somebody who's sick and who has skin breakdown, such as an ulcer, or who has mucositis. So our focus for this session is really going to be about clinical care. So let's get going with the first part of the lecture, which is about knowing your tools. And it's a bit like saying, Houston, we have a problem, in terms of the fact that there are so many different terms for what might or might not be a hydrolat. So here you have just a list, and it's not an exhaustive list. There's more what are we talking about? Hydrosol, hydrolat, hydrulat with an E on the end, an aromatic water. Is that the same thing? What about a distilled water? What about a distillate water? These are all terms that are used in the literature. Medicated water, fragrant water, floral water, aqua distillatae, eau florale, herbal distillate, aquaromes, distilled plant waters, the list goes on. And so it really is something that we need to be aware of, is that not all these terms mean the same thing. And when you are trying to source hydrolats, you can run into problems if you are not able to get clear information as to exactly what the product is. So I wanted to give you a little bit of introduction here, because this is often where people, if we start off on the wrong foot, we can go down all sorts of routes that are not going to be beneficial to the person. And we may be using products that we think are hydrolats when in fact they're not at all. So I wanted to give you a couple of examples. So the one thing I would say is that, hydrolats are not an invention of the aromatherapy world. They've been around far, far longer. And also hydrolats are always linked to distillation. That's the first point to say to you, is that really, we're not talking about a new wave of using aromatic products. This isn't brand new. This has been around for a very long time. Hydrolates have been used for a very, very long time. But also hydrolates, the one thing you can say about all of them is that they have been a product, they are a product of distillation. And we'll see that sometimes they are co-products of distillation and sometimes they are the primary products of distillation. So if you go back in the literature, I'm not a historian, but I do like to go and see where people first start talking about things. And I wanted to take you into the early 1800s. I live in France. This is a French text. It's a pharmaceutical text that was edited by Antoine Chéreau. And Antoine Chéreau, it was a pharmacist. And in 1825, in this particular text that he wrote, he has a definition of a hydrolat. Okay, so hydrolats are medicinal waters that are obtained by distillation. For example, rose, lettuce, elderflower, etc. A hydrolat is an ordinary distilled water. So you see that the word distillation is right there, very much so in the definition. It may surprise you to see lettuce being mentioned there, but in fact, when you go back into the old hydrolat texts, many non-aromatic plants were actively distilled for their different virtues. Now, who actually gave the name hydrolat initially? It might well have been Antoine Chéreau, although, I'm not 100% sure. But certainly one of his colleagues at the time, in the same sort of time period, as you can see, we're talking about the early 1800s again. Here we have another pharmacist called Pierre-Joseph Barral, who in 1830 referred to Antoine Chéreau as the originator of the term hydrolat. And in his book that he edited, Barral actually details 4 hydrolats with explanations of their preparation. And in this particular text, he details the preparation of Roman chamomile, elderflower, valerian, and cinnamon bark. Now, in the 1800s, the hydrolats were actually quite a thing in terms of their medicinal virtues and their particular uses. But this soon fell out of favor when we entered the 1900s, and with the advent of antibiotics and different other medicines, the hydrolats started falling to the wayside and also being removed from the different pharmacopoeias. But in the 1800s, these were actually important substances for pharmacists. Here's an example of a formulation that in 1844 was written about by Dr. Magne. This is an ophthalmic preparation. And here you can see it's in the Journal of Medical Chemistry, Pharmacy and Toxicology. It was a formulation for blepharitis and conjunctivitis, where rosemary hydrolat, rose hydrolat, oleander hydrolat, which is interesting. Oleander is a toxic plant, but they were distilling it for its particular medicinal virtues, as well as other things like quinquina bark tincture and something called pierre divine, which is detailed on your slide. It was a preparation made of different sulfates of copper, aluminium, and zinc, along with potassium nitrate. It's quite a concoction that's liquefied, overheat, and added to crushed camphor. And then it's poured onto a greased surface and cut into tiny pieces before it hardens. And then this is mixed into this liquid preparation. The chances are this made the preparation even more antiseptic in its effect. But here you see that back in 1844, they actually had ophthalmic preparations for instilling into the eyes 2 to 3 times a day for treating things like blepharitis and conjunctivitis. So once again, we're not in a new wave of therapy. We are in a renaissance, if you wish, of hydrolat therapy, by the fact that we've seen a great interest over the past 20 or so years of using these wonderful distilled waters for care. Now, here's one of the problems. Okay, so if you look in the British Pharmacopoeia, the third volume, there's mention of aromatic waters. And here is an example of a rose water, okay, which is made according to the British Pharmacopoeia standards, and it's classed as an aromatic water. Now, the word aromatic water in some countries is synonymous with hydrolats, but it's a problem because, in fact, this aromatic water that's being talked about is not a hydrolat at all. So aromatic waters, by definition in the British Pharmacopoeia, are saturated solutions of volatile oils or other aromatic substances in water, it's usually distilled water, usually employed for their flavoring rather than medicinal properties. And they are prepared as described below, which is by diluting a concentrated ethanolic solution of the aromatic substance with water. And so by virtue of the fact that they are in a concentrated ethanolic solution, there will always be a small amount of ethanol included in the product. And in terms of the British Pharmacopoeia, there are 4 individual monographs on aromatic waters. You have anise water, camphor water, cinnamon water, and rose water. But if you take a closer look as to what is this aromatic water, what you see in front of you, you have distilled water, rose oil, which is dispersed in ethanol, and it is added to that water. So is this a hydrolat? Even though distilled water is used, it's not a hydrolat, because a hydrolat comes through distillation of plant material. A plant material has never met this product. This is where you're combining different things together to make an aromatic water. In terms of the French Pharmacopoeia, the 2012 version, there's a bit more detail, but once again, you have to be very, very careful about the terminology that is used, because we have distilled plant waters and flavored plant waters. So if we're talking about distilled plant waters, this is where we're talking about hydrolats. Distilled plant waters are obtained by steam entrainment of various parts of plants, whether they're aromatic or not. And they consist of the recondensed aqueous phase, or hydrolat, and separated from the essential oil if there is any. And in the particular case of the use of flour as a raw material, it's often used the term distilled floral waters or floral waters. So there's some examples that are given here. This is directly from the French Pharmacopoeia: distilled cherry laurel water, or floral distilled water, distilled rose water, distilled orange blossom water. And these are hydrolats. They're the same thing. In terms of flavored plant waters, though, we have these are different substances where you have purified water, where you have aromas of plant origin that are dissolved in that purified water, or they've been stripped with water vapor followed by decantation and filtration. So these are not hydrolats. Even though the word waters is there, these are not hydrolats. These have not gone through the distillation process. The plant material has not been subjected to the distillation process, and there hasn't been a recondensing of the aqueous phase of the product. So if you look at the ISO definition, which is where we're getting closer now to having an international definition, a standards definition, here we have a more clear vocabulary. It's really quite simple for your hydrolats. You notice that the ISO have a hydrolat with an E on the end. They're also called aromatic waters in this definition. Now, your hydrolat is an aqueous distillate which remains after steam distillation and separation of the essential oil whenever possible. So this means that if you have an aromatic plant and you distill it, you're going to have two phases. You're going to have the aqueous phase and the essential oil phase. If you remove the essential oil phase, what you're left with is the hydrolat. However, if you have a non-aromatic plant, as we saw a little bit earlier in the slides, a lettuce, if you want to distill lettuce, lettuce is not an aromatic plant. You won't get an essential oil, but you will get the aqueous phase. So you will recondense the distillate waters and obtain a hydrolat. The term distillate is something that is very clear. This is a product of condensation obtained after distillation of a natural raw material. So let's be very clear that a hydrolat is what's come through the entrainment of steam, through the distillation itself, that has been recondensed and then separated out from the essential phase if it is present. Now, the term hydrosol can also sometimes be confusing because in purely chemistry terms, hydrosols exist in the chemistry world. And the term hydrosol, if I was a pure chemist, is a sol, a type of colloid in which solid particles of very small diameter are suspended in liquid. So we're not talking about distillation here, we're not talking about plant material. And in fact, in physical chemistry, hydrosols are colloidal suspensions in water, and they're usually referred to in terms of colloids of gold or silver, aluminium, and copper. So that term, hydrosol, itself can also be confusing. Now, the wonderful Jeannie Rose was the first person in the United States to use the word hydrosol relating to the aqueous products of distillation. And she related hydrosol to the first part of the liquid distillate when freshly picked plant material was distilled. And something that Jeannie Rose has been very insistent on is that when you are distilling for hydrosols, it is the fresh plant material that is used wherever possible. And in her explanation of choosing this term hydrosol, she says hydro means water, sol means solution, the new liquid that results from plant distillation. It is the aromatic, non-alcoholic distillate left from the distillation process of organically grown plants that contain water-soluble plants of the plant material and microdrops of the essential oil. That's actually a definition that Jeannie Rose herself has given. But as you can see, it's a bit like the whole thing about aromatic waters and hydrolats. They can be different definitions according to who you are or what industry you are in. So let's bring it back then to hydrolats. What this class or this lecture is referring to is that the hydrolat is the distilled plant water recuperated following hydrodistillation or steam distillation. If it's an aromatic plant that is used, hydrolats are co-products of distillation. For non-aromatic plants, lettuce as an example, the hydrolat is the principal product of distillation. And it also depends on the distiller as to what they are distilling for, because a distiller can distill an aromatic plant for the purposes of recuperating the essential oil as the main product, or as the hydrolat as the main product. And so even there is a subtlety, because if in the ideal world, if you are buying hydrolats from a supplier, that person or the person who's distilled that product ideally is distilling for the hydrolat as the primary product, or what they are looking for is the quality of the water and not necessarily the essential oil, even in the case of an aromatic plant. So something else to say is that essential oil constituents have varying polarities. And during the distillation process, a proportion of the more polar or hydrophilic molecules will dissolve in the water and the steam, and a small portion of them will remain in the hydrolat, which is why when you're distilling an aromatic plant, your hydrolat will have an aroma. It's because there is a portion of the polar or more hydrophilic molecules that have dissolved within the steam, the water, and are therefore found in the hydrolat in very, very small quantities. You can also occasionally find low levels of hydrophobic components in the hydrolat in microdispersion. It all depends on the type of distillation that is used, whether you're likely to find them or not. But you can have non-polar substances in the hydrolat. Although they're not in solution, they may well be in microdispersion. So let's talk a little bit about polarity, because the hydrolat and essential oil composition from the same plant can be very similar or very different, and it's all down to the chemistry. So if you see on the slide, you have a slide with an arrow going from the most polar, which means most water soluble, to the least polar, the least water soluble. Then you sort of have a sliding scale. Now it is a very rough sliding scale. Here, there may be differences between individual constituents, but on the whole, if we talk about the plant acids, the volatile plant acids, these are amongst the most polar constituents. You will rarely find them in an essential oil, but you will find them in the hydrolat because they are so water soluble. So if they were volatile enough to come across in distillation, you are going to find them in the water and not the essential oil. And likewise, for the saturated hydrocarbons and the unsaturated hydrocarbons that are the least polar, there you're unlikely to find them in the hydrolat and more likely to find them in the essential oil. Because they don't like water, they are hydrophobic, you will only ever find these in very small amounts in microdispersion in the hydrolat, whereas you may find them in very large quantities in an essential oil. So basically, it is down to polarity, and it also depends on the type of distillation, the duration, etc. But the main point here is that your essential oil and your hydrolats are not necessarily mirror images of one another, which is something that's sometimes alluded to in the literature, that basically say a lavender hydrolat is just a weakened or diluted version of lavender essential oil. That's not the case. These are two separate substances. They have their own chemistry and therefore their own potential uses and also potential challenges. So there's a lot of variability in hydrolats. The aromatic constituents in a hydrolat can vary very widely with the species of plant in question. They can also vary in their concentration depending on the distillation technique and especially the distillation duration. The chemistry and the concentration can really change. The ratios of plant can vary. The plant to hydrolat ratio is an important thing to know, and it's important to ask the distiller themselves, are they distilling on a 1-to-1 ratio or a 1-to-5 ratio, etc., because then the constituents and the concentration may well be different. Some waters are cohobated, and also the material of the distillation apparatus is going to give you variability as well. Whether the person was distilling in inox or copper or glass, these might actually also influence the composition overall. So the other point to say is that hydrolats don't just contain essential oil constituents. They can contain other volatile substances that are water soluble that have come across in distillation. And that might include certain volatile pesticide residues. And this is obviously an area of concern. Or it may be that during the distillation process within the still itself, especially in the condensation part, there may be contamination with heavy metals if the distillation apparatus has levels of heavy metals such as lead. Another thing to say is that hydrolat analysis is not complete. And we have such variability here, which is unlike with essential oils. With essentials, when you distill a plant, you're pretty sure you're going to get fairly consistent composition out of the end product. But in terms of hydrolats, there's so much variability. They really do vary extremely from batch to batch and from distiller to distiller, and for all the reasons that are mentioned here on the screen. And the big thing here I would want to say is that distiller experience is absolutely essential. If you're going to be sourcing hydrolats for use in clinical care, you are sourcing them from distillers that are extremely rigorous with their quality control and their distillation experience and methodology. You're not sourcing your hydrolats from somebody who's cooking their hydrolats in a kitchen or using a stovetop apparatus and then selling on something they've grown in their backyard. You're actually sourcing your hydrolats from people who have years and years of experience and also who have all of the quality control, especially to do with hygiene, in place to ensure that what you're buying is not a contaminated product and that is something that's really truly effective. The other last thing here is that correct botanical identification is absolutely essential. You need the Latin name of all of your hydrolats. You need to know just as much about them as you would do if you were using an essential oil. In terms of variation, this slide is just to say that if you wanted to go further and start to use hydrolats according to their chemical composition, in order to make sense of the hydrolat chemistry, it's important to know the concentration of volatiles in the hydrolat. And, we're talking about concentrations that are expressed either in milligrams per liter or parts per million or as percentages. And the variation here, once again, is enormous according to the distillation time, the ratio between the plant material and the hydrolat collection, and this can vary by a factor of more than 1,000. But typically, we're talking about up to 0.1% or 1,000 milligrams of volatile organic constituents per liter of water that are typical in a hydrolat. You do have hydrolats with a slightly higher concentration of constituents, but it is extremely low. So essentially what you have in your bottle of hydrolat is water, just water, with a fraction, an absolute tiny, tiny fraction of aromatic ingredients. And that helps to explain why hydrolats are so fragile compared to essential oils, which do not contain water. So hydrolat analysis as well is more challenging than with essential oils. It's more costly. It's an evolving field. It's not complete. There is an extra step that is needed so that you have to first extract the volatile fraction from the water before you can go on and conduct a gas chromatography or mass spectrometry analysis. And not all volatile organic compounds will be detailed depending on the solvent that was used for that first extraction phase. So the more information you have about the hydrolat that you are purchasing, the more you will know of how you could possibly use it. So let's talk about the second part of the session, which is challenges and potentials. We're going to start with challenges first and get them out of the way, and then we'll get into the potentials and the fun stuff. But there are certain challenges with hydrolats. A lot of them are around sourcing. Sourcing difficulties for quality hydrolats is really quite a thing. I would certainly suggest that you look to source your hydrolats from as close as possible to where you live, so at least within your own country, because when you are shipping liters of hydrolat, 1 liter is 1 kilo. And also if it's been around the world a couple of times on a ship or in transit, long-term transport, the chances are is that when you're obtaining the hydrolat that you want to use, if it's from a far-flung country, it's been around a while, and the risks of contamination are probably higher. There are challenges of storage and stability, which I'll mention in just a moment. The challenge is also that not many suppliers analyze hydrolats and provide you with that information, so it sometimes can be hard to know how to use them. And also, it has been, until fairly recently, difficult to access quality literature and research in terms of use and efficacy. And here I would just give a shout out to the Circle H Institute and Botanicals, the Hydrosol headquarters that is hosted and run by Anne Harmon. You have the link at the end of this session to Anne Harmon's websites. There, if you are looking to access good literature on hydrolats, that's the place to go. That's your one-stop destination, really. And also another challenge, as we've mentioned, is heavy metal contamination, which is particularly something that's been brought to the fore in the last few years. So, potentials. Hydrolats can be used in clinical environments, and they are used in medical devices. I'll come on to a couple of them in just a moment. They have multiple actions, they're very versatile, and they are useful for vulnerable patients for whom essential oils might be contraindicated, and they're very gentle to the body, mind, and the spirit. But here are some of the challenges. We've mentioned sourcing, quality control. We don't have robust international standards for hydrolat production and storage. Essential oils have a much longer history of standardization and recognition on the international platform. And so we don't have this yet in place really for hydrolats. Another thing to talk about is the fact of storage and handling. I'm going to come on to that in a moment. The issues of sterility and contamination and shelf life, and also responsibility, because we do have people that are producing hydrolats and selling them because there's been this huge upsurge in interest in these amazing waters, and it's a financial, it's a commercial venture now, and sometimes you have access to hydrolats that really shouldn't be on the market. They should be distilled carefully with experience and with very strict hygiene and quality control places in place, rather than having something that's been cooked up in somebody's kitchen. So responsibility is important, and your responsibility, if you're going to use hydrolats with patients who are vulnerable, your responsibility is to obtain the best product that you possibly can. And as I say, there's a dearth of research in terms of hydrolat use and hydrolat extraction. The best collection of research I've ever found, and that I think is a worldwide collection that is unbeatable, is the research compilation that is at Circle H Institute. Continuing with the challenges, your hydrolats are not always easily accessible. They may not always be possible to purchase for a clinical use. They're not always pleasant smelling, and this is something to bear in mind. Just because you have an essential oil that has a delicious aroma does not necessarily mean that the water of that plant, that distilled water, is going to smell gorgeous as well. And in fact, sometimes the aroma can be off-putting to some people. These are not sterile substances. They're only sterile when they first come out of the still as distilled water. And from that moment on, they are fragile. And so how the distiller themselves prepares the material and the collection containers and sterilizes them or not, as is often the case, is very important, because the biggest risk of contamination is at that very first step, when that distilled water drips out of the still and it's all sterile, and then it's being dripped into a container that is not. So your biggest risk is right at the very beginning. And then, of course, the risks accumulate over time, as the more handling, the more bottling, the more transformation, the more risk that you have. And in a clinical environment, it's because of all of this that they're often refused by infection control, because they're essentially water, and water can harbor bacteria, very often gram-negative bacteria, can also harbor fungal organisms. It could pose a risk if somebody has broken skin or you're applying this product to mucosa such as eyes or inside the mouth, etc. We also have a challenge in that they have a short shelf life once you are preparing them. We'll come on to shelf life in just a moment, but once you transform a product, you have very, very short shelf life with Hydrolat containing products. And there's also a risk of product instability. In terms of potentials, though, they bring really quick relief for many situations. They can be used as often as the patient needs them because they have such a low concentration of active ingredients. It's unlikely they will have irritation or toxicity or allergy. You can combine them with other actives, as I want to show you in just a moment. They carry a very low risk to the patient, and they can be very discreet in their management of certain symptoms. And they can be used, generally speaking, for all age groups and for all disease states. It all depends on the species that you're using of Hydrolat. But in general, they're far more versatile and easier to use than your essential oils. So the patient is vulnerable. The patient in a clinical setting is looking for something pleasant to help them with their suffering and with their symptom management. They need something that works. And also sometimes essential oils or other strategies are just not possible. And here Hydrolats offer a lot of benefit. In terms of handling and storage and shelf life, just remember that each Hydrolat has its own concentration of volatile components, and thus stability and ability to support microbial growth varies greatly between Hydrolats. And contamination of a Hydrolat doesn't only produce a risk to the patient, but those contaminations can also contribute to further changes within the Hydrolat itself. And contamination is more common than you may think. It can be present without any changes that you could see. So that's important. Some changes, microbial changes, are completely invisible. So by the time you see something floating or a bloom or a change in odor or color or turbidity of a Hydrolat, the changes have been there for a very long time. And so you do need to be very aware, and they cannot be filtered out. Once a Hydrolat has spoiled, it's spoiled. You have to throw it away. You can't fix it. Because their pH is usually from acidic to neutral, there is some claim that they do not support microbial growth because an acidic environment tends to be more hostile to microbial growth. Unfortunately, that isn't the case. Your microbial contamination is possible, even if Hydrolat had a pH of 4. Other factors can increase the risk of instability: light, heat, air exposure, and also the contamination can come during processing, handling, storage, transport. The more steps there are between the distiller and yourself, the user of the Hydrolat, the more chance you have of contamination. In terms of stability and shelf life, as a rule of thumb, we say that conservation is recommended to be limited to a year post-distillation. So knowing the distillation year is really important. And that should be something that the supplier can easily provide you with. You need to know when that Hydrolat was distilled. Once you have opened the Hydrolat, then we say use them up quickly. It doesn't mean that they have spoiled. It just is that once you start using a Hydrolat, use it up. It's a fragile substance. Use it up within a few months. Any blooms and sediments are indicators of change. It might not necessarily be microbial change. It may be chemical change. Okay, so it's not typical to see any sediment or bloom or anything floating or moving in that water. If there is, it means there's life in there, and maybe you won't want to be putting that on a broken area or an inflamed skin or on somebody who is fragile. Another thing to say is that, yes, cool temperatures for hydrolats in terms of their storage, there may be more argument for that than with essential oils. But I think the main thing to say is that uniform temperature is even more important. Try to avoid extremes of heat and cold. If you have one space where you're storing your hydrolats that is cool and that is uniformly so, that's possibly more beneficial in terms of preserving your hydrolat than taking it out of a cold space and taking it into a hot space and then putting it back into the cold. It's those fluctuations in temperature that actually can increase instability. The fact that they're sold in narrow-necked bottles is also something that is very useful. Handle them minimally. Don't have them in wide open containers. Don't leave them open to the air. Definitely don't sniff them directly from the bottle because your risk of contamination is extremely high. The temptation is there, especially amongst aromatherapists who are so used to opening a bottle of essential oil and smelling the oil. The essential oil doesn't support microbial growth, so it's not really a problem, but it is a problem for hydrolats. The moment you waft a hydrolat under your nose, you have a risk of contamination, a direct risk. So we need to get out of the habit of doing that. I'm talking to myself as well, okay, because my first reaction often is to want to smell the hydrolat. Another thing to say is that when I dispense to patients, I'm only ever dispensing small amounts of a hydrolat preparation, usually for a maximum of 15 days use or less, but they're always in small amounts. Examples of clinical care. We can do many different things with hydrolats. We can put them into gels and creams and lotions and compresses. We can use them as mouthwashes. We can use them in spritzers. We're going to put them as eye drops or nasal sprays. We can use them in multiple ways. I'm going to give you some examples, some concrete examples of that in just a moment. So just talking about hydrolats from an external point of view, they have multiple properties, as I've said earlier. They have variable properties and very, very useful, especially when we're dealing with issues to do with skin and mucous membranes. They can be cooling, they can be anti-inflammatory, some of them are analgesic, some of them accelerate tissue repair, some of them are antimicrobial, antioxidant, and decongestant to the skin. So there are wonderful benefits of using these amazing waters. In terms of potential uses of hydrolats, these are some of the reasons why I've used them in clinical care over the years, for things like itch or rashes or dermatitis, to edema, to wounds, weeping skin, helping with hot flushes, helping with things like intertrigo, impetigo, even soothing and decongesting and bringing relief for hemorrhoids, using them in intimate hygiene, shingles or zona, helping with pain, multiple uses. And I'm going to give you some examples right now. So here is an example of a medical device that contains German chamomile hydrolat. This is available in France. It's a medical device. It's available in pharmacies or bought through pharmaceutical suppliers. This is a product of Horus Pharma. And here we just basically have unidose eye drops of German chamomile hydrolat. These are sterile preparations for eye care. So no other ingredients are in the product apart from being preserved with citric acid and trisodium citrate, and they are supplied with sterile eye compresses. And this is for really sore eyelids, puffy eyes, and eye irritation. These are extremely effective, and these are ready to go. Just German chamomile hydrolat for its soothing, anti-inflammatory, and antimicrobial effects. This is a major product in France. It's just been relaunched this year. It's called Les Gouttes Bleues by Laboratoire Inoxa. It's registered as a medical device. And this is an example where hydrolats are combined with one another. So here you have 4 different hydrolats: cornflower, German chamomile, euphrasia, or also known as eyebright, melilot, for its anti-inflammatory properties, And this is a combination product. It's only 10 milliliters in size because it has no preservatives in. And so these are eye drops, which are extremely beneficial for sore eyes. And there is trehalose, which is a sugar derivative that helps with increasing the humidity and the lubrication under the eyelid, so it brings extra relief. But basically, this is a hydrolat preparation. It's only in a tiny product. It's got a special dispenser so that when you drip the drops of these hydrolat into the eye, each drop is dispensed in a sterile way. And then the instructions is to use within 28 days of opening. So remember, short use always, especially with skin and mucous membranes. A really wonderful product. It's been around for a very long time. It was taken off the market with the European changes to the European cosmetics regulations, and now it's back again now, having gone through the whole process. It's a really important product here in France. Another example is Collier Optigem. This is 100% cornflower hydrolat. This is one of the longest used hydrolats in the French pharmacopoeia, especially for eyes. Hydrolat of Centaurea cyanus, which is cornflower, for eye comfort, for tired eyes, eye fatigue, can be used with contact lenses, because in this product, there's only the hydrolat, nothing else. Once again, it's just 10 milliliters. And has a special dropper for application. This is another product that is more recent, but I've used this for people who have really puffy eyes, for example, linked to hay fever or seasonal allergies. It is a cosmetic product. It comes in individual sachets, so each product is sterile. Comes in a set of 2 patches, and this is cornflower hydrolat that has also got witch hazel, it's got seaweed, it's got vitamin B5, and it really helps to reduce the puffiness around the eyes. And it's really quite an interesting product. You also, moving away from eyes, but the eye care is the area where hydrolats as medical devices are have the most use in the pharmaceutical world. But here you also have for nasal hygiene. Here is another one from La Drôme Laboratoire. This is to show you that hydrolats can also be mixed with other products such as propolis and other plant extracts. So this is basically a thyme hydrolat that has also other things added to it, such as echinacea, grapefruit seed, propolis. And it's for hygiene and just general nasal hygiene, and is anti-infectious. It also has saline to have an isotonic or hypertonic effect as a nasal rinse. Along similar lines, here's another one. This is again using propolis and lavender together. The lavender is the hydrolat, and it has some alcohol and potassium sorbate as a preservative. Once again, it's for general nasal hygiene, often used at the time when there are colds and coughs and sneezes. Here's another one that is about oral hygiene. Now, this is not a medical device. This is produced directly from a distiller, and they have distilled their own plant material and then combined these hydrolats together. This is for oral hygiene. This is a really cool product. It contains mountain savory, wild mint, lavender, and bay laurel for general oral hygiene, for gargling, for mouth rinses. Very good for when people are having dental work and really needing to up the oral hygiene side as an oral rinse. Here, if you're buying from a distiller that is combining hydrolats, you do need to be sure that you are buying from a distiller that has everything in place in terms of hygiene and distillation technique, sanitation and storage, that they have everything correctly done so. Now, here just to wrap up this session, just a few examples of how I work as well. I've given you some examples of what's out there on the market, but here is also like typical pragmatic things that I do. One of the things I love to do is combine clay with hydrolat. This is an example of making a compress or bandaging an area with hydrolat and kaolin. Given you the measures here for about 100 milliliters of hydrolat, you would choose the hydrolat that's appropriate for the particular need. And to that, I add a measure of kaolin. I'm not weighing it out. I'm just using the actual measure so that you see the type of liquid that's produced. I combine them together, and then I'll actually soak gauze compresses or bandages in that solution, and then bandage or apply the compress to the area. This is really good for skin reactions, insect bites, swollen limbs. This is a beautiful, soothing strategy in clinical care. Really delightful, and it leaves a soft, powdery feel on the skin once the bandage has been removed. Another thing that I like to do is to make thicker clay poultices. This might be for an ulcer or an infected area of skin where I'm looking for the adsorbent and absorbent properties of clay combined with hydrolat. Here I will take my green clay, I'll add the chosen hydrolat. It'll probably be an anti-infectious one like thyme hydrolat or laurel hydrolat. And I will then make a thicker preparation with clay and apply it to the lesion and leave it in place for at least 45 minutes before I remove it. And when I remove it, I haven't left the clay to dry. The clay is still moist when I remove it, because we need the clay to remain hydrated for it to do its thing. Once it's dry, it's no longer working. So I remove it whilst it is still moist. And in that state, it is easy to remove. Really remarkable for healing infected areas. Another thing that I do is I combine hydrolats with with gel. Gel such as aloe vera. I use a ringing gel, something that has a firm consistency. I'm not using aloe vera juice. I'm actually using the juice that has been jellified, okay, with a gelling agent. And to this, I can stretch hydrolat with. So I can create a more fluid gel that can be fluid enough even to pump out of a pump spray bottle. So it's like a thickened water. So I'm thickening the hydrolat with something that's active, my aloe vera gel. And this provides really amazing relief to skin irritations, to itch, and for soothing acutely inflamed skin conditions. It works for longer than if I just use the hydrolat on its own, because the thickened element with the aloe vera gel will prolong the hydrolat's efficacy. Lastly, the last formulation is just a different example of something that I do. I work a lot of times in cancer care, and we often have women who are in artificial menopause or who have hot flushes as a result of their treatment. And here, this is a simple hot flushes spritzer. I love to combine bergamot mint with neroli and peppermint hydrolats. I put them all together. I put them into a spray bottle, and then the person is using that to spritz to reduce the intensity of hot flushes. Once again, I don't make a liter of it at a time for the person. I'm making small quantities. It's in a spray bottle, so the chances of contamination are reduced. And if the person prefers it, these could even be made into baby wipes if they don't want to be seen to be spraying themselves when they're in the middle of a hot flush. Very effective formulation. This is something that's quite new. This is a question mark that I have, a future for clinical care. What we really need, a bit like the Camomid eye compresses that you saw in individual Unidose sachets, Is this something that we could really do with in clinical care, because the sterility of the product is extremely important for us. So this is a company that is not to do with clinical care. This is a company that is more to do with flavoring waters and possible cosmetic effects. But the idea is there that you can have unidose sachets of Hydrolat blends ready to go in a clinical environment for cleaning wounds, for example, or applying to soothe lesions with no preservatives, no risk. And this is something I'd love to see happen in the future. We're a long way away, but this is what I'd love to see. So the conclusions and key reminders. Hopefully this has been useful and interesting for you. Hydrolats are easy to use, they're effective, they're safe remedies for the relief of many symptoms in clinical care. We're seeing increasing use in clinical environments, and we're starting to see a growing evidence base. They can be used alone or in combination with other products. They can have a problem, though, in terms of sourcing and in terms of quality sourcing, and also, of course, to do with their stability. And if we get to this stage where we have widely available unidose preparations, that would really increase the use in clinical settings. So if you are sourcing Hydrolats, this is the last slide. Questions to ask, okay, when you're trying to find somebody who is going to supply you with Hydrolats that are what they should be, as it were, so that they are clearly identified, that the distiller is experienced, that they know their tools, their technology. They are able to give you the information you require about the year or the season of distillation. They can tell you about their purposes of distillation. Are they distilling for the essential oil or the Hydrolat itself as a principal product? What was the plant to Hydrolat ratio? What's the alembic material? Is it glass or copper or inox? Are they organic? Do they use fresh plant material? Was it hydrodistilled? Is it steam distilled? Was there coagulation used? Is there any filtering system? There is a microfiltering system that's sometimes called sterilizing filtration, which is 0.22 microns of filtration to ensure even further that the Hydrolat is not contaminated before it goes into the bottles. Is it analyzed? If it is analyzed, can you see the analysis itself? Because it gives you so much information about the product, but it also shows you if the producer or supplier is really equipping themselves with the knowledge and skills to assure you that you actually have a true Hydrolat in your hands. Is there a batch number? Is there a traceability? If there's no batch number on a bottle of Hydrolat, how on earth are you going to be able to find out if you have a problem with that Hydrolat? How will the distiller or the supplier know which Hydrolat that they supplied you with was the problem? It's absolutely essential. It is with essential oils as well, but for traceability purposes, batch numbers are essential. The storage conditions as well are important. So lots of questions, lots of challenges, but I hope you can see as well that there are many potentials for using Hydrolats in clinical care. I've mentioned several links in the lecture. They are listed here. I would just highlight your attention to the last three. This is the work of Anne Harmon with the Circle H Institute and her Hydrosol headquarters at botanicals.com. If you're looking for sound information about Hydrolats, that's certainly a place to go. And just a last word, always work within your sphere of competence, and also know that this field of Hydrolat therapy is changing, is growing, and we need to always keep abreast and as up to date as is possible. And I'd like to thank you for your attention and your time, and I wish you an amazing Aroma Summit. Take care, everybody.